But I suppose my argument then is that society has changed, the nature of our job has changed and has become much more difficult. I haven't even mentioned British yob culture or the increasing threats of violence, or the fact that 20 years ago it would hardly be heard of for a nurse to be assaulted, and now, obviously, just a few months ago we had a nurse that was actually killed here in London. And sadly, those sort of instances they're still fairly uncommon, but they still potentially could happen every single day on acute wards. So I think whilst the job has changed, the system in which we're working maybe has failed to adapt, and the staff that remain are struggling with a low status, a perception of sort of low specialism, and perhaps are suffering from the fact that almost every other element of what's known as rather laughably, the whole system of mental health and psychiatric provision, almost every other element of the whole system, in my opinion, has been able to define itself, often from the word go. You're almost bound to have here intensive home treatment teams just setting up, probably been working for the last, I don't know, year or two if you're very lucky. I worked with one of the very first ones at North East London in Walthamstow, and I was very impressed to see that they actually had admission criteria. Well, not admission, but acceptance criteria, and they were very clear on who they wouldn't work with. And it seems to me that many services function in that way. It seems to me that the only element of the service, very likely, that doesn't actually have those criteria are acute wards. You remain, if it's not too offensive, you remain a dumping ground. That's not to say that the patients themselves deserve a dumping ground, if you like, but I think many of our professional colleagues sometimes lack the imagination to think, what should or could we do? And they think instead, this patient could do with a stay in the ward, even though sometimes that may not be clinically justified or in the best interest of the patient. It's probably reasonable then to say that acute wards are places that do provide services for people that require them, but it's probably reasonable also to say that we provide services for professionals that just don't know what else to do. And there are examples of services where they actually have grasped the nettle. I was told by a doctor in Cork just this week about his time at South London Maudsley Trust, where they formed the view that people with a primary diagnosis of personality disorder would, whenever possible, not be admitted, but that it wouldn't be enough just to say, no, you're not coming in. They chose to regard that person's presentation to the services as a demonstration of a need for increased intensivity, if you like, but the old-fashioned knee-jerk response would be, okay, well, we'll admit them. Their response was to actually have a crisis meeting of all the relevant professionals. The patient, in some cases, would actually be sat in the waiting room outside, and they would actually develop a package of care, if necessary, for a few, that would probably go over for a few days, but may actually be more sustained than that, but which would actually, of course, take results, but wouldn't require that person to actually come into the ward. Now, I think that sort of quality of thinking is necessary, but I think possibly even before that, acute wards in many cases, we would be well served by getting our own house in order before we started the positive ripple effects of actually working with the whole system in which we're, just one part. And that's something that with the refocusing project I've been trying to do with about 40 wards, trying to help them get their house in order, help them reclaim that sense that the wards are actually theirs, that they're places where you can do a good job, where you can engage with people, which justifiably should be seen as a specialist and very challenging practice area. And once those people, in a sense, get their motivation back, you can then start coming to the table on an equal basis